Hi everyone, how are you all doing? I haven't seen you in quite a while, so I thought I'll come to you and just talk to you about how things are going in this new year 2024. So much has happened. I hope you're keeping well. I hope you're keeping your physical, mental, and spiritual health sound. I hope you're protecting yourself and giving yourself lots and lots of self-love, which is so important. So this year, what do we have to look forward to in terms of our wellness and our health, and just generally with healthcare, across the world and where you are? I think this is the year where people have to really take self-care seriously, particularly with the cost of living crisis, which is through the roof. In almost every country, everybody's feeling the pinch. It's also the year where we start to be more responsible for things like climate change and really seeing the effects of climate change on our health, and then starting to take that seriously. You will see that in many countries lots and lots of regulation is coming in, and I'm particularly happy about the fact that Lagos has taken a step to ban all plastics, which is going to have an effect on our health directly. So today I'm just going to talk to you about, just healthcare and how to access it. If you want to look at one of my Twitter posts earlier in January, there was a lot of excitement about it because I mentioned that people are going back to Nigeria to get their healthcare, which is true, and some people agreed and some didn't. The main thing is wherever you are, you want to seek the most accessible healthcare for you. You want to ask lots of questions, and you want to make sure that your health is being treated with the utmost seriousness and respect. You are the one who's going to look after yourself. Doctors will help you, but you have to advocate for yourself. So that's been very interesting. Lagos, people go back to Lagos in particular for healthcare. Lots of things are being done there, and I have lots of links, and if you think that will be helpful for you to know, have a directory, or you'd be willing to sort of get involved in developing one, then let me know, though we're already developing one within my circle. So yes, people go back to Lagos. Lagos is also a center of medical excellence when it comes to elective care. And when I say elective care, is care that you've planned. So for instance, if you're trying to conceive and you want to have fertility treatment, then you can plan that. Or you want to have a screening test done, like a colonoscopy to look inside, all of those sorts of things can be done excellently well in Lagos and in Nigeria and other centers, not just in Lagos. When it comes to emergency care, however, that's a different kettle of fish, but I do know that the government is taking steps to bridge that gap. Emergency care are things that you don't plan. You don't plan a heart attack, you don't plan an accident, you don't plan anything that just happens suddenly. You don't plan that. For that, you need a very responsive healthcare system that can get you within a few minutes and get you to the best center within the hour. And we're not quite there yet in Lagos and in Nigeria, but we will get there. We have to look after our own healthcare system. So even if you are abroad, there's nothing wrong with that. You should always seek to develop where you're from if you can. I've worked in abroad and I've worked at home, and for me it's always very important to develop both systems as best as I can, and I'm definitely passionate about the healthcare system in Nigeria, and I know that we can achieve great things, particularly with the new leadership in the Ministry of Health that we have. So that's some of the things that have been going on. I will always tell you to check your blood pressure, check your weight, have your blood test to hand, know what your blood tests are, eat well. And there's one secret this year, which is not really a secret, is intermittent fasting. Intermittent fasting is reducing how much you take in as a way of feeling better. So it's kind of you eat, but you only eat within a certain time. I've been practicing intermittent fasting for quite a while because it helps to clarify my mind. It helps me just to feel better in myself. Doesn't mean that I don't eat. I eat very well, but it's just at certain times. Intermittent fasting has helped with lots of reversal of some illnesses, or remission of some illnesses, even like diabetes. But obviously always seek advice before you go ahead and do that intermittent fasting. So that's my one tip for today. So make sure that you seek the best healthcare accessible to you. Don't rule out or shut down any healthcare system. Don't say, well, Nigeria is terrible, so I'm not going to go there. There are some amazing centers and doctors in Nigeria, and nurses and pharmacists, and don't ever rule that out. So it's very important to keep an eye on that. Also be responsible for your own health. So, you know, remember about climate change, and just be sure that you're looking after yourself. You're your own best advocate. Know your numbers. Know your numbers. So that's my welcome into 2024 for you. Remember to like, subscribe to the channel, our YouTube channel, and also suggest topics that you want me to cover, and so we can in due time just bring the best accessible information for you. Remember to look at some of my products, and just follow me on social media. It would be nice to chat to you and just see how you're doing. All right, have a great day.